when we talk about the challenges we face in immunization programming in the state prior to the coming of the EU signed project, is mainly we talk of logistics, especially when it comes to the management of a cold chain system.
So we are seriously in need of capacity building, system strengthening.
We don't have enough health facilities in all the communities, and the health facilities are not accessible to some of our communities.
The absence of a working cold room, both at the state level and at the area council levels.
The Provisional 2018 National Demographic Health Survey, published by the National Population Commission of Nigeria, shows a progressive significant increase in the immunization coverage across the states from 13% in 2003 to 25.3% in 2013 and now 31.3% in 2018. This increase can be attributed to the various efforts and intervention made by the Nigerian government in conjunction with other development partners towards uptake of routine immunization across the country.
Nigeria primary healthcare system was weak. There was weak administrative structures. Primary healthcare systems were not working optimally, and this really led to the establishment of the National Program on Immunization. But rooted in this was the appalling results that showed from the 2003 National Demographic and Health Survey that the coverage for immunization was right around 13%. This was a wake-up call.
Despite Nigeria being a middle-income country, there are still a lot of children, I'm told more than 200,000 a year, that die from diseases that can be prevented through vaccination. So that in itself is already a very strong rationale. But through all our support in the health sector, we try to contribute to improving the health systems, which can help Nigeria to improve its performance, because in all indices, Nigeria performs very low.
Before the EU signed support, we were using the conventional refrigerators to store vaccines at the facilities. And you know, some of these facilities are located in the very remote areas, and they had challenges with electricity.
Yes, our challenges include frequent breaking down of cold chain equipment in the facilities.
But then, unfortunately, we couldn't have a function, at least a cold store that will be able to deliver that mandate due to, you know, we have structural, we don't have enough structure, and, you know, logistics to run the cold store was also one of our challenges, but especially the space, the structure, and also the equipment.
There was no agency, the primary healthcare development agency, there was none. Attempt was made to have the bill passed, but the bill got lost on the way. So there was no agency. And also the local government system, which is responsible for primary health care, they were not, there was no political commitment by them, coupled with the fact that they don't have a lot of money.
With a population of over 185 million people in Nigeria, 4.3 million of the 7 million children born in Nigeria every year fail to get fully vaccinated before their first birthday, according to the UNICEF's 2016-2017 Multiple Indicator Cluster Survey to support the Nigerian government's effort in eradicating vaccine-preventive diseases between 2002 to 2019. The European Union have invested over 200 million euros, specifically through 3 projects. They include the European Union Partnership to Reinforce Immunization Efficiency, EU Prime, 2002 to 2009. The European Union Support for Routine Immunization in Kano, EU SHRIC, 2007 to 2011, and the European Union Support for Immunization Governance in Nigeria, EU sign, 2011 to 2019.
Nigeria has economic cooperation relationship with friendly countries, and the EU countries are part of this relationship. The EU has intervened in various sectors of the Nigerian economy. In fact, it's one of the largest donors to the Nigerian, to the support for Nigeria. And since 2002, they have intervened in health sector, being one of the sectors in the country, and there have been several programs. We've had, like you've mentioned, the EU Prime, the EU SWIC, and currently the EU sign. And this support has been mostly in the immunization delivery service.
So what EU sign is doing is to build on the achievements of that particular, of those particular earlier supports. The project is designed as an embedded project within the government system. That is to say, the management of the project is not, management arrangement is not done outside government institutions. Everything is done within the existing government structures. So to that extent, the National Primary Healthcare Agency designs its own plans, and these plans are in line with the National Development Agenda. So all what we do is to ensure that the resources that are made available from EU are targeted at what the agency wants to do, to implement as much as possible those plans. The EU does not dictate what the government should do. The government determines, the government is in the driving seat.
So with the EU sign, the difference with the focus on the governance structure is to embed the management team within the existing government mechanisms. And the hope is that there will be some form of mentoring, transfer of knowledge and capacity, so that when the project ends, we still have a critical mass of government staff that can carry on the activities.
So in the EU sign project, the wisdom there was that they hired a state coordinator, which came and worked with the state accountant, the state immunization officer, and a focal person in the immunization office.
You see, when you have resources, you have human, you have material, and you have, and you don't have the capacity, then nothing will work well. So that is why EU sign support is key, and it makes a huge impact because it's a targeted system strengthening by, building capacity and all that. That was what we were liking.
The overall objective of EU sign project is to contribute to the reduction of childhood morbidity and mortality of children under the age of 5 in Nigeria due to vaccine-preventable diseases by making routine immunization permanently available and contribute to the interruption and the transmission of the virus and total eradication of polio in Nigeria. This component was implemented between the European Union and the World Health Organization. The project, in alignment with the federal government, Primary Health Care Rehabilitation Program, constructed new cold stores and health facilities while also rehabilitating old cold stores and health facilities. These includes boreholes and standby generators. Provided 757 direct drive solar refrigerators in health facilities in the focal states and the FCT. Provided 29 four-wheel drive vehicles to support vaccine logistics and other related commodities to their point of need. Supply of 136 computers. Technical support that include training of health workers, data management, community-based stakeholders, etc. Strategic planning and other related activities.
So when EU came into Shongom local government, they were able to provide the bus which is now a road that is helping us to travel to the hard-to-reach area for service delivery, for conveying our vaccine from the state headquarters down to the local government, then down to the service delivery point.
Before EU signed, we already have a MOU, that is Memorandum of Understanding in Kano, that is actually for routine immunization. But the presence of EU sign as systems strengthening, instituting accountability, it has done a lot. It has done a lot in the area of logistics, vaccine security and logistics. EU sign supported all the technical working groups.
Before now, the LG has been recording red and struggling to record yellow. But I want to tell you that now we are recording green. EU has been a contributing factor to this great success of climbing from green or yellow that was crawling to green. I mean, from red to yellow, we were crawling to green. Is the support of the EU. Because if the EU did not support us with this storage, I don't know how it will have been.
Our health workers' capacity were built. This leads to improved delivery, and our performance rose to the extent that we were first in 2017 immunization in Nigeria.
The state government has also renovated 63 PHCs, 3 per local government, and each was equipped with basic equipment, basic furniture. We were given tricyclic ambulances. We call them keke in the local parlance for prompt referral.
The contribution of EU has really assisted, since we know that immunization is the entry point. And we have been able to use immunization as a rallying point. In fact, one of our major interface with the local government is the area of immunization. And with the assistance of EU sign, strengthening our routine immunization services, we have been able to entrench immunization services across the 20 LGA, and that has also been our line of communication with each of the 20 MOHs in the 20 local governments of Ogun State.
For the implementing agencies to sustain the gains that have been achieved through the support to improve immunization governance, the National Primary Healthcare Agency has carried out a number of reforms in the last two and a half years to lay a solid foundation to deliver primary healthcare services in the country.
The EU also has supported primary healthcare under one roof, especially with the current EU support to immunization project. And it did this through galvanizing support for establishment of the state primary healthcare development agencies and board across our 23 states and the FCT.
All across the country, all states have now established the state primary healthcare boards. That is fantastic, right? And then even with that, in terms of achieving the 9 pillars, the EU SAN project has been very, very key in providing monitoring for the scorecards, to see in the development of the scorecards, to see how the states are doing, so that on a regular basis we're able to show to the states, here are the 9 elements for you to succeed in implementing primary healthcare under one roof. Here is a scorecard that shows how you have done.
The EU SIGN project has also been able to help resuscitate health intervention across some of our communities. One of the notable one is the Fajo community. Fajo community is in Abeokuta South, and it's a community that is heavily populated. And if they will seek any health intervention, they have two options. It's either to go to another local government, which is close to them, that's another local government, or move back in time to another wards in the local government. But with the intervention of EU Sign, they have been able to give the community a state-of-the-art health facility, and the facility is equipped to handle mother and child health intervention.
If you consider governance in general, you cannot carry out governance of anything without taking into consideration the people that you want to deliver service to. So, under the NPHCDA strategies, one of the key strategies they have is to strengthen what we call the community engagement. So, a lot of communities where facilities are established are brought into partnership. They are involved to ensure that they play active roles in managing the health services that are being delivered to them.